Let's get started. Hi, everyone. Thank you so much for being here. My name is Ed Reed. I'm a former school administrator, past president of the Maryland School Counselors Association. I'm a current school counselor and a commissioner of the town of Poolesville. I am so excited about today's conversation on student behavioral health in Maryland. But before we get started, I did want to let folks know that today's session will be recorded and you can adjust your settings however you are most comfortable. I also wanted to share some resources that we might reference throughout the session. And so I'm thrilled to be moderating today's panel discussion. Before I introduce our panelists, I want to let you know we all have about 10 minutes at the end of today for questions and answers. If you have any questions, please drop them in the chat. Our amazing team will compile the questions that you have, and we'll do our best to get to many of them as possible. Without further ado, I will introduce our amazing guest. First, we have Dr. Fulham. And her pronouns are she and her. She's with the National School of Social Worker Association in Maryland. All right, and Dr. Fulham is a Maryland transplant by way of Virginia, but welcome to Maryland. We're glad to have you here. She's the mother of 3 and a daughter of Fletcher and Willie Fulham, both African and Native Americans. She's a licensed clinical social worker who currently serves on the legislative committee for the Maryland National Association of Social Workers. She also serves on the Social Action Education Committee for the National Association of Black Social Workers in the Metro DC chapter. She has served as the president of the ABSW Hampton Roads and currently works as a school therapist at a Maryland alternative school and the owner of Renew You 2 LLC private practice that provides therapy and consultation services in Maryland, DC, and Virginia. Next, we have Mara Agron. Let's see here, and she's with, thank you here, and she's with the Maryland School Psychologists Association. She's the current president of the Maryland School Psychologists Association. She's been a practitioner for 19 years in Baltimore County Public Schools. She's been the president of her local district association of school psychologists, as well as the treasurer for many years. She also worked as an affiliate professor with Loyola University and Goucher College in departments of education. So in an effort to bridge the educational and psychological understanding, she's a registered psychologist, associate in Maryland and in private practice. She provides therapeutic services to children, families, and adults seeking to improve their mental health and overall being. Ms. Ergen's passion for students, families, and schools are an anchor and a guide in her various roles and responsibilities over her career. We're so glad that you're here with us today. We also have Dr. Ham, Dr. Nikki Ham. She's the president of the Maryland School Counselors Association. Dr. Ham has served as a school counselor for over 15 years with successful experience in organizational and instructional leadership. Now, during her time as a school counselor and a school counselor leader, she had a proven track record of success in improving student performance, developing teams, and building bridges between the school, parents, and community leaders. She is currently an assistant professor of counseling in the Department of Counseling at Bowie State University. She's also a licensed clinical professional counselor in Maryland. Dr. Ham is dedicated and passionate about helping students and their families remove the social, emotional barriers to their academic success and achieve mental health wellness. Dr. Ham serves as the president of the Maryland School Counselor Association. And finally, we welcome Mr. Wes Moore, Democrat, Maryland gubernatorial candidate. Wes Moore is a combat veteran, small business owner, Rhodes Scholar, and former CEO of one of the nation's largest anti-poverty organizations. He has devoted his life work to a basic principle: No matter where you start in life, you deserve an equal opportunity to succeed, a job you can raise a family on. And let me say it one more time, a job that you can raise a family on, a future you can look forward to. Now, Wes was born in Tacoma Park, Maryland, and he was just 3 years old. And his father died of a rare but treatable virus. Wes graduated with an associate's degree from Valley Forge Military College in 1998, and then Phi Beta Kappa from Johns Hopkins University in 2001. Now, as a teenager, he intended for former Baltimore, he was an intern for former Baltimore Mayor Kurt Smoke, and then went on to earn the Rhodes Scholarship, which took him to Oxford University. Now, inspired by his mentors at a military school, Wes went on to serve as a captain and paratrooper with the U.S. Army's 82nd Airborne, and including leading soldiers in combat in Afghanistan. He also served as a White House fellow advising on issues of national security and international relations. And so let's get ready to get started. You can learn more about Wes by going to his website, and you can learn more about his bio. And we're getting ready to hear from Wes Moore shortly. So let's get started. Welcome, everybody. We are truly grateful to Wes Moore for taking time to talk with the representatives of the organizations that support student health in schools. I love to start off having the representatives each take 2 minutes to share with Mr. Moore and the rest of our audience 2 things. So let's get ready. We're going to dive in here. So first, who are their members in the organizations and the role they have in schools supporting student mental health in schools? And so panelists, as we get ready, I want you to think about who are the members in your organizations and their roles, the roles they play in supporting our students' mental health in schools. And then second, we're going to talk about this current year. Now, we just got started, but we want to look at what are some of the challenges your members experience in doing their job to support student mental health in schools. What, if anything, feels unique about this back to school season? And we'll start with the Maryland School Psychologists Association.
Thank you. I'm really happy to be here representing the Maryland School Psychologists Association and our over 500 school psychologists in the state of Maryland, among our 24 different counties. We have had a lot of interesting challenges that really make up the needs of our members and how we can support our students in schools. Our job is one of many hats. We are diverse in our expertise, and we not only support the academic, but especially the social and emotional support of all students. However, one of the main concerns that we have experienced for many years now and doing our job is the shortage of school psychologists in Maryland. And I know Mr. Moore and many others on this panel, we all experience the shortages. And since the pandemic, it is exponentially challenging because our caseload or ratio of students to practitioners is really the most significant concern. The recommendation from our National School Psychologists Association is 1 practitioner for every 500 students. However, currently, Maryland is experiencing the ratio that is significant in comparison. We're more than double that. We're in 2020, 2021, we are 1 school psychologist for every 1,061 students. And that was 2 years ago. That was a year ago during the midst of the pandemic. And so with retirements, resignations, and burnout since the pandemic, this ratio is sure to have changed. The other significant concerns that we see are the challenges with the social and emotional needs of our students. of all of our students, not just the students that are receiving services from us or under the guise of our support services, but really the systemic needs of all of our students. And before the pandemic, the social and emotional needs of our children were at a critical point. Since the pandemic, we're looking at that point well in the rearview mirror. We're putting out fires and Rome is burning. Essentially, it's a concern that we need to be able to support our systems at that systemic level to really provide that overarching social and emotional support and learning opportunities for our children and our families as well to support their children. Really, the SEL, that social emotional learning, is really an important piece to all of the academics. And as well, equally important to the academic and testing expectations of our students in their learning. If they're not healthy emotionally and socially, they really can't thrive in any and all areas. Another important piece to our concerns are really the career ladder. And I speak to the career ladder in that Maryland is one of these amazing states that really supports education and supports the addressing education as in the forefront of our needs and values for our children and our future. And so the Maryland Blueprint for Progress was created to address the needs of our teachers and to ensure those adequate opportunities for reasonable income as we really shape the minds of our students. School psychologists, along with our other mental health providers, were left out of this legislation. And mental health providers and mental health should be as equal and as important as the academic needs of our students. As such, we should be able to be supported and compensated, but also growing our role and growing our members and our professionals in our organizations in Maryland. The last thing that's, I think, interesting and maybe unique to school psychologists is our Medicare billing. And that's a question of, in the state of Maryland, school psychologists who are mental health providers cannot actually utilize Medicare billing for our services in schools, like maybe our social worker colleagues. This is due to the way that the wording is written in some of the health regulations. So this is not the case in other states. Many other states around the country are able to utilize Medicare billing. And so this is a missed opportunity for school psychologists to access funding that can impact, really have a significant and positive impact on the needs of all of our students.
Thank you so much. And it's very important points that you just made. And next we want to go to Dr. Fulham with the National Association of School Social Workers.
Yes, thank you so much, Mr. Reed. Thank you, Dr. Ham, for having me here today. I also want to extend gratitude to Ms. Gail Martin, who is chair of our School Social Work Committee for the National Association of Social Workers, and Mr. Scott Tiffin, who is our lobbyist from Policy Partners, who helped us prepare for today, and I appreciate that. And thank you to Mr. Moore for obliging us and being here to hear some of the concerns that we have as we approach this school year for 2022-23. I first want to start by saying that social workers, school social workers in particular, have a specialized position within the profession of social work. And what we do is we bridge the gap between school, family, and community. We've been uniquely trained to manage the needs of vulnerable populations. With that being said, I would echo everything that my psychology colleague has to say in terms of being left out of some of the incentives that the academicians may have been provided, where we are struggling with burnout as well. When we don't have the money, the support to be able to provide for our workforce, then we suffer You know, we hope that this particular administration would be able to support us with the interstate compact that we're trying to gain, you know, so we can have reciprocity in other states. That would be super helpful. We also hope that we can have loan forgiveness for school social workers, paid internships. But I think if we look at the bottom line, it's poverty. You know, I was, you know, blessed to be able to conduct a study. And the results of the study, when we look at student outcomes in science and math for particularly African-American males in middle school, it was poverty that was keeping them from being able to thrive and be able to achieve. And we look at the social emotional needs that have been exacerbated in a negative way since the pandemic. Lack of access to technology was a big piece of that because of poverty, but also they've come back with social anxiety. They come back with generalized anxiety. And if we want to add the differential diagnosis, maybe even ADHD. And we know that there has been a correlation with poverty and crime, and then crime and kids not having fathers in the home, which also led to a diagnosis of ADHD when we saw the influx of men being incarcerated. So we have to look at the macro pieces of how we got to this point. The legislation is one, supporting our schools, the Title I schools, so that they have access to more resources. Parents want to be participatory in their children's educational and social emotional development, but they can't when they're living in poverty. And I think that if we really tackle this thing at the root, then it's poverty. So those are
Dr. Bland, thank you. I'm sorry to be that person because there's so much, and you hit on so many very important topics. All right. And I got the pleasure of being the guy who keeps the time and keeping us moving.
Thank you, sir.
But thank you so much. Very important points. And I love that idea about paid internships. And I would say probably for all three professions.
Yes.
I know you all can't see her. I have my intern from Johns Hopkins here with me sitting on the side. And so that's a really important piece because we think about the sacrifices interns make. And so it poses a challenge. But let's keep moving. Dr. Ham, can you talk to us about the group that you represent?
Well, hello. I'm really just echo what all my colleagues were saying, and thank you more for taking the time. I know you have a very busy schedule, but serve our students. We really appreciate that you're willing to listen, and that's important because we all are. I always say, school counselors, school social workers, and school psychologists. We're like a wonderful singing group, and we really work hand in hand together. People sometimes think, oh, we're kind of interchangeable, but we really aren't. We need each other to provide the support to students. So a really great school would have one school counselor, school social worker, more than one actually, ideally, but at least at minimum one of each of us housed in the house of the schoolhouse, so that we can provide the support. Because the school psychologist will do some parts of it, the school social worker will do that community piece of it, and then school counselors, we can do some pieces in terms of providing the social emotional wellness for all of the students within the school body. So we work really, really closely together. So I have the honor of serving as the president for the Maryland School Counselors Association, which represents over 2,700 school counselors in the state of Maryland. Maryland is great in the sense that COMAR stipulates that every school, every child has to have access to a school counselor, which we love that language, but it can be sometimes a little bit challenging because what we have found is, and like all my colleagues were saying, we're having to do so much more with so much less. And the more of the needs of our children. I mean, it breaks our heart. I'm sure our members will all say very similar things in terms of the social emotional needs, the trauma that they've experienced. I mean, COVID, social distancing, isolation has really just risen to the level of, anxiety, depression, all of those things. At a younger age, I know my elementary school counselors are reporting a higher incidents of suicidations that are being reported at elementary school, which is heartbreaking to us as school counselors, and I know to my other colleagues as well. So that, I think, is the biggest challenge, is we're having to do more, but not having as many resources. And when I mean resources, I mean persons, people. I think that's probably we're all saying the same thing. We want training and we like those things, and certainly we'll talk about the financial piece of it. But I think that goes hand in hand because we're not seeing as many counselors, social workers, school psychologists that are coming into the schoolhouse to work in the schoolhouse. There are probably a variety of different factors, but I'm sure one of those would be money. So it is definitely something that we are looking to partner with to figure out how we can provide the support, the incentives to get people to come into the school to work as a school counselor, as a school social worker, as a school psychologist. So I think that probably is what school counselors are seeing as the biggest part of it. The other piece, and I'll say this, and then is the other tasks that we have to do. A lot of times we have things that are assigned to us and we are just helpers by nature, but we wind up getting pulled into having to be the manager of 504, very clerical things that are, wonderful when you're helping, but they get us out of the job of what we are hired to do, which is to serve and provide support to students. So we're really glad to start this conversation and looking forward to the next parts of our conversation.
Well, absolutely. Thank you, Dr. Ham. And Wes, Mr. Moore, as you sit and you're listening to these three very important organizations that we're all working together. It's like a triple braid. A strong braid has these three. And I have a daughter, and I learned how to braid hair a long time ago. And a strong braid can get you moving. And so, as you've been traveling around the state for a long time, and you're in different opportunities to hear from countless Marylanders. And so, what specifically have you heard regarding the needs of families to support their children's social emotional well-being in schools?
Yeah, thank you so much. And first, Ed, just bless you and thank you so much for being just a remarkable moderator, but also leader in our communities. And to Dr. Fulgham and Ms. Edgerin and my dear friend Dr. Ham. This is an absolute joy to be with each and every one of you. And I have to tell you, everything, and I'm sitting here taking notes because everything that you all are saying, whether we are talking about school counselors, social workers, or psychologists, it is consistent with everything that I've been hearing around the state of Maryland for the past year and a half. This has been an incredibly trying time for people. This has been an exhausting time for people. And we're watching how the shortages are happening at the same time that you're watching the needs increase. Right. So it's not like you're watching shortages and the work decreasing. It's shortages and the work is increasing. So it means the people that are there are now have increased weight in terms of what they're then having to deal with. And there's multitudes of the weight. It's not only just the challenges that people are continuing to see. It's also the fact that the resources to be able to deal with that have not translated with the increased workload. It's about the fact that the mental health challenges that it's is not even just about the mental health challenges for the students. It's the mental health challenges for the educators and the psychologists, because at some point you have to remember, are we helping the helpers, right? The people whose job it is to support our children and our families, they need support as well. And so I think there's a larger compounding that we continue to see that I think we just have to be incredibly deliberate and intentional for. Because I think it was said beautifully that, what happened during COVID, it was not just an exacerbation, it was an exposure of something that was there before. And now we're just watching continued weight. And so I think that there's a few things that I know as I think about it, and again, I'm excited to continue to not just share, but also just to continue to listen and learn. We've got to do more to get more people inside of these seats. When you're looking at a ratio in the state of Maryland for school counselors that's sitting on, about 370 kids per counselor. In Baltimore City, you're watching how the ratio is more than 900 students per counselor. The workload is not just unfair, it's unreasonable. And so we've got to do more to actually create pipelines, pipelines of support. We have to do more to actually create, ways of being able to incentivize people to stay within the profession. So it's not just about recruitment, it's also about retention. And what are the things that you can do, both in terms of, financial supports, as was mentioned earlier, but then also workplace condition supports. because if you can increase pay all you want, but if you're asking a person to work in conditions that are unfair, they're going to leave. They're going to find something else to do, and which is going to create increasing pressure on this. And also, I think there's a piece that we're talking about. What are the support mechanisms that we have in place as well? I was I think Ms. Edgerton, I think you mentioned the blueprint, I believe, and the blueprint. That was something I was very proud to work on, very proud to watch passed, and thankful when the legislature had enough votes for review to override. And I can tell you that and again, not to get political on it, but the reality is that if I end up being elected, our administration is going to fully fund the blueprint, period, full stop. And then we work in partnership in order to properly implement it. But knowing that, it also means there are certain elements of the blueprint that are not there that are important. So for example, we talk about pay increases for educators, but we don't mention paraeducators inside of the blueprint. We don't mention other things like social workers and psychologists, et cetera. That also needs to be included when we're talking about supports and increases. And so I think it really is how are you thinking holistically about educational supports, community schools, because it's not even just about curriculum adjustments. We also have to support students when it comes to everything from dental care to eye care to food supports, because that's going to be just as important when it comes to the long-term development of the child and the long-term development of the family.
Thank you so much, Mr. Moore. And I'm really hearing you talking about the structural challenges. And so these things that really need a whole overhaul, because as you talked about, there's the increase of the need and the decrease of the resources. What that sounds like to me is that there's a pool and there's tension. And so in order to relieve the tension and get the work taken care of, we have to look at some things differently. Now you hear the bells behind me or above me because I am in a school. And so we talked about some of these challenges, but let's shift a little bit. And I'd like to hear from each organization about some of the evidence-based interventions or strategies that you're using, that members of your organizations are using, that that can help, things that we might learn from one another. So take a moment. I'm going to have you share just briefly, and I wish we had more time, but we don't. So let's look at, in this time that we do have, I want you to share some of those evidence-based interventions or strategies that are being used or you need to have access to support the social emotional well-being of students throughout the wonderful state of Maryland. And I'll start with Mrs. Egron, and hopefully I'm pronouncing your name right.
It is. It's Igor, and thank you.
Igor, and thank you. Sorry.
That's okay. It's not the first time. It's been changed slightly, but I go by anything. I'm just happy to be here, honestly. I think some of the evidence-based practices that are really helpful, looking again, not only at how school psychologists can help and support the school systems and families, but really look at the social emotional learning curricula. And the term SEL, or social emotional learning, is really a key factor that we have all been working to implement over the past many years now, but it's been I'd say, 5 years or so that it's been much more intensive. And we utilize that to really support all of our students within the whole classroom and the whole school and system-wide setting. And MSPA really helps to support training, and we're really leading in the training and intervention practices for our students and schools. Each system utilizes different and unique SEL programs that they see that need to fit for their particular student body. Our conferences and webinars that MSPA provides really help to provide that professional learning practices to be able to utilize those programs in various schools. In fact, next Friday, the 21st, is our fall conference, and MSPA is hosting our own homegrown school psychologist practitioner, Dr. Byron McClure, who I believe maybe you've met before, Mr. Moore. has actually created wonderful SEL systemic programs for students. And also he's really helping us to look at how we address culturally affirming practices to influence that systemic change, to address all of our students of need. So, you know, we really are, this is our mission, this is our practice. I would be happy and love to invite you all as my personal guest to our conference next Friday. If you're available and interested, it would be a wonderful way to collaborate all of the work that we do. And certainly, Mr. Moore, we would love to invite you to participate and see firsthand what that looks like and how we as practitioners really take that information back to our systems and then begin to utilize that.
Yes, please.
Yes, absolutely. I'll be happy to send that that information out to you and get you scheduled with us. But we're really working on, we're so focused on the remediation and the crises, you know, that we really can't meet the needs of all of our students with these evidence-based SEL practices because of the way that they are supposed to be implemented. They're not implemented with fidelity, meaning they're not implemented the way that they were designed. They're not as beneficial to all of our students. So we're missing our population.
Thank you so much, Ms. Igorian. Hopefully I got it right. And so there's definitely some great points as you talk about the conferences, the collaboration, the social initiatives with implementing social emotional learning programs with fidelity. So such critical points. And let's look at our social worker partners. What are some of the things that you're seeing that are able to be effective or things you would like to have access to?
So I really love the evidence-based tools that we use in the school system to help provide a framework on how we're going to approach the needs of students. We implement a multi-tiered program and practice, the multi-tiered system, systems and support, which is the positive behavioral support. So we are rewarding positive behaviors. We also monitor progress and we evaluate service effectiveness. When we look at the tier, you see social workers are providing more of the tier 3, which is the more intensive services. And I have to go back to the blueprint because when we talk about the ratio of students to social workers, our recommendation was 1 to 250.
Yep.
And I think we're 1,000 times more than that. Okay. So at over 2,000 students per social worker. And so when you look at the magnitude of the work that we're trying to provide on a daily basis, is having more social workers, where we've seen in research that having a social worker present at a school increases the graduation rate by 97%. And right now, you know, for those who are most vulnerable, which is those populations that we are specialized to support, the transgender, the LGBTQIA community, minority students, they're at 50% dropout rate across the country. And so we have a really important role to play in the schools in terms of making sure that we add some sort of way to collect data in terms of the importance of and the effectiveness of what social workers do and what we bring. And I always feel obligated to define what school social workers do, because as Dr. Ham said, sometimes we kind of get all melded in together. And I think that concentric circles are important, but we also have to make distinctions in terms of the contributions that we make. So when we're asking for funding, we can justify that. Having a tool that supports that, having staff, those human resources to support, developing a tool that allows us to collect data to get to that end is important. We have a curriculum that we're using in the school for school social workers. However, the curriculum was designed for educators. And so it's not that you're teaching them as if you're teaching some sort of rubric, but we want to integrate social emotional learning into their day and make it a part of the learning process, so that it's a natural occurrence where we're capitalizing on opportunities to teach students how to how to develop relationships, how to communicate effectively, how to express their feelings. We've adopted the Association of Black Social Workers in DC has adopted a school, and I know we're focusing on Maryland, but we have allowed them to use their art classes every quarter to express themselves through their artwork. And those are tangible pieces that we're able to see where students may not be able to go home and talk to a parent or a loved one or a significant other about, this is how my day went today. I mean, if we want to get down to the nuts and bolts of it, you know? And so those students who are at Title I schools in Maryland, they're more likely to not have those types of supports. And we do see at tier 2, if we're going back to MTSS, the multi-tier system of support, we're assessing. That's the role of all of of everybody in the building, the teachers, the paras, the psychologists, the counselors, everybody is assessing the students' needs. And so we all have a unique part to play at the school, and in terms of trying to help the students develop socially and emotionally. And I think with the integration of technology, you know, we love progress, but it definitely has played a part in it as we try to teach children how to socialize more.
Thank you so much. And it's such key, very important key points that you made. I'm taking some really good notes here. And I'm hearing this theme about relationships, access, so that students can have outlets, and at the same time, the importance of integrating evidence-based programs. And so let's hear from the School Counseling Association. What's going on over there?
Yeah, I mean, I think it is one of the things that I would love to say, and that's why we work really well together with each other, because it's very similar in terms of what Dr. Fulgham was saying, which was the, data. I mean, it's so significant in terms of who we are and what we do. And we really do, each of us use that to drive in identifying where the areas of need are, and then what are the interventions or strategies to implement that. But I think one of the things that really stands sometimes in the way of being able to do these evidence-based programs, specifically using data and collection of data, are the others that duties as assigned that we get caught into as a counselor. And so the data really suggests, specifically for us, the American School Counseling Association, that is saying instead of doing scheduling, class scheduling, which we get caught into master scheduling being a very, very expensive master scheduler or clerical assistant that you have that's really entering numbers, because you're paying someone that is a master trained person to be a data entry person. And instead, the best use of time for that person would be, school counselor, would be to really look at identifying, consulting with teachers, looking with and meeting and reviewing curriculum, presenting on a school counseling curriculum, lessons on developmental needs and needs that are identified through the data. That is the best use of our time. So instead of doing those sort of things, really another wonderful strategy or evidence-based strategy is, instead of having school counselors looking at and doing, a variety of different things in terms of, and we like to be helpers and really be a part of things and to be a helper, but another component of what we're really uniquely trained to do is to provide that short-term solution-focused counseling in schools. And so we have the capability, the training to do that short-term solution-focused, and being able to then provide resources to our students, to families and our students and families, in partnership a lot of times with our school social workers and our school psychologists, with outside community resources. But we need to be able to be available to do that. And then the last thing, and I know you're big on this, Mr. Moore, which is really increasing a free, quality and professional development and training opportunities for our school mental health staff, school counselors in areas of particularly the LGBTQ community. Because one of the things that I'll tell my truth. It's a long time since I've been out of school. And when I was in school, the training wasn't there, the resources and material. And so as educators, as counselors, we are constantly looking for opportunities to be able to do that, to do those. And so those are another, what we have found to be really an effective evidence-based strategy to really be able to ultimately, I always say, increase students' ability and availability to learning, because that's really what every parent sends. One of my colleagues used to say, when they're sending the best 3-year-old they have, they're sending the best 5-year-old that they have. They don't have another one they don't have another one at home. This is it. That 8-year-old that they're sending into school is the very best one. And so as counselors, I want to meet them there with the very best that I have available.
All right, thank you so much, Dr. Ham. And as we're listening to, and I'm listening, I'm jotting down a lot of notes from you as well, looking at that an effective evidence-based strategy is that use of time, right? And that's really what I'm hearing. And I'm hearing this being able to do data-driven intervention. So time to analyze the data, time to do that short-term solution-focused counseling, not being therapists. School counselors are not therapists, but there are many times I've done it throughout the day to day. And so I definitely know what it's like. And so you have those things that pull. And when we heard from Dr. Fulham and the remarks from Ms. Ergon, there are those those circles that we all have, but then there's overlap, and then there's direct things that we do differently. And so, Mr. Moore, as you're listening to all of this, and I know that you've spent a great deal of your time fighting against poverty, a great time making sure that students had access to higher education. So what are some programs that you might be familiar with that you believe would help support families throughout the state of Maryland?
Yeah, I'm loving this conversation because so much of you're learning about this idea and continue to learn about what works. And the thing that I've always kind of learned, and I tell people, like, this is my first time. I never run for office before, right? I've been involved in this work for my entire adult life. So I've been a public servant for my whole life. I just haven't been a politician, right? But I've been involved in these work and working on these issues. And one of the things I've always I realized, more and more, especially kind of as we transition this world, is every solution you're looking for is actually out there and being done. The biggest question is, how can you then make sure that you're listening and then supporting and then scaling, right? And I think about so much of the work that we did, when I ran Robin Hood, which is one of the largest poverty fighting organizations in the country. Is like, there was, everything that we were looking to do, whether it was dealing with food insecurity, housing insecurity, early childhood supports, mental health supports, job training, job reskilling, criminal justice reform. It was about, how do you find the organizations that are on the ground actually doing the work, coming up with the results that you're looking for, and being able to better understand and analyze why what they're doing is working, and then finding ways to be able to scale up that work. And so, I'm thinking about so many things that people are, so many that this remarkable panel is saying here. What we're talking about is not just an identification of a challenge, but also there are best practice mechanisms that are taking place in individual communities right now. And so to your point, Dr. Reed, where I think about, for example, how are we dealing with the psychological trauma of violence as one example, right? Where, we ended up actually investing about $1.5 million in violence interruption and violence intervention platforms. And you're thinking about how you're watching programs that are on the ground right now doing the work, because the level of trauma that our families, our children continue to see and to feel, because of the fact that in many of our communities, violence and mental health challenges, et cetera, we're the largest provider for mental health services in our country is the prison system. That's the largest provider for mental health supports. When you consider the fact that you have such a high percentage of people who are coming in, 70% of people who are incarcerated we're dealing with substance abuse or mental health challenges as they were incarcerated, right? So that becomes the largest provider of services. Whether you're talking about things like job reskilling and job retraining, and how are you helping people that are coming back into society, who are returning back home. We supported programs like the Center for Urban Families or the Fortune Society, programs that are doing really good work and helping particularly young parents, majority men, majority African-American men, and helping them to reacclimate, job retraining, giving them pathways back into a workforce. So you're seeing how these initiatives are playing and doing a really good job of being able to do the work. They just got to be identified, funded, scaled, and supported. And so I know, for example, from a government perspective, that our administration, our hopeful administration, is planning on doing things like reinstating the governor's office for children. It was something that we had in place before. It has been eliminated by this current administration. If we have a chance to have an administration, it will be reinstated. We think it's important. We think it's important to actually have a focus in the governor's office that will help to broaden the full scope and focus of social and emotional well-being, trauma-informed care, expanded service to essential behavioral health services, combating food insecurity, all these things that become necessary to deal with the holistic growth of the child. And we know from experience that we're not going to be able to do this alone. And so while it's important and it's powerful to have organizations that are doing this type of work, and even jurisdictions that are doing this type of work, the best thing that we can do is find ways to collaborate, identify, fund, build, and scale. Because if we can do that, we are going to get ahead of the challenge that we're facing and be able to deal with it. So it's not just 50 kids here or 100 kids there that are benefiting, but how are we changing systems that continue to allow so many children and families and communities to fall between the cracks in the first place?
I love what I'm hearing from you. And as my pen is moving, you can't see how fast it is. And there's a couple of things that really come together as we're sitting here representing some of that infrastructure that really needs to be strengthened to help the next generation here in Maryland. And the thought that keeps popping into my head is, look at the impact of a pipeline for economic development. And when we think about how change is taking place in the country, in the world, there are new skills that are needed for new businesses that we want to attract. And when businesses move to the state of Maryland, the expectation is that you have a workforce ready with those skills, and not just the skills from a four-year institution, but those skills that come from trades, the skills that come from apprenticeships. But in order, whether it's the student who goes on to be the doctor or the student who goes on to be the plumber, both students need to be well. And so when you talk about the collaboration, the funding, the scaling, as I look at my other page here, I looked at listening, supporting, and scaling people on the grounds. So I'm going to take this opportunity and say, imagine if there was a task force that represented all 24 counties in the state of Maryland that had what you see right here on the screen, where you have a social worker, a school counselor, a school psychologist. I'm sure there's some others who should be there. But if you had a if you had a social emotions or student well-being teams that come together in a think tank, like a task force, that begin to say, here's from your boots on the ground. This is firsthand information that doesn't get filtered out by layers and layers. And being able to have those teams have these kind of conversations where we have much more time than what we have today. But understanding the constraint of time, I want to transition and listen from each one of you. And a success, if you could share with us, because we have about 10 minutes, if you could share concisely, what's a strength that you've had last year, this year? And so we'll start with our president of the Maryland School Psychologists Association. Give us a success that you've had.
Sure. I think our school psychologist organization is one, we're consummate professionals. And I think that is evidenced by the work that we do, not only within the school systems, but also supporting our universities and our training programs within the state. We are in Maryland are exceptionally blessed to have several universities, in fact, 2 HBCUs that have school psychology training programs. And so they are our light and our promise for our future, to be able to support the needs of our children within our school system. Our challenge is keeping those students who become interns, who become practitioners within our state. And that is always our biggest challenge, because there are lots of incentives and there are lots of other reasons to leave our state and find employment elsewhere. I think that as school psychologists, we recognize the need for the professional support and recognize the need to provide, the support and services to those populations that have been historically under resourced and minoritized, and make sure that they are getting the equitable support across all marginalized communities. And I'm really and particularly in agreement with the need for the LGBTQ training to support our children and families in this day and age. It is challenging. It is different. We're seeing, we're seeing the conversation happen at all levels of our school system nowadays. And so there does need to be a lot of support. And that's something that, again, my organization in doing our conferences, we do look, and we have that actually scheduled on our conference events. So again, check out our opportunities, and we'll connect with that. So we're doing wonderful things, and we definitely have a lot of those things that we feel are successes in what we are doing.
Thank you so much. And I know you all are doing a lot of things. A lot of people don't even know it's happening, but you all are in the trenches doing these things. All right, I'm going to switch over to our National Association of School Social Workers. Give us a success, and we'll keep that concise.
Yes, so I am so super proud to say that the Legislative Committee of the National Association of Social Workers did work last year during the legislative time to have a law passed that supports mental health days for students to be absent from school. I think it speaks to the core of, the needs that it goes back to the fight we had before with mental health parity, treating mental health just as we do physical illnesses. Okay, so we are still fighting for parity. There's research to support that. I guess the Milliman study would be one that we could look at in terms of when we do use an integrated healthcare model. It is a big support for the insurance companies as well as for us as mental health professionals. We're all health professionals. And so I think that was an awesome feat. Now we're pushing to for this particular legislative period, we want to look at gaining universal screenings for mental health so that the entire state, if not the entire country, can have a universal screening for mental health that is included when students are being enrolled into school, so that we all are speaking the same language and we can have some sort of rubric to quantify what it looks like for a student who's coming into the system who has some mental health issue, and we can tackle it from the beginning. Early interventions are best.
Thank you so much. All right, Maryland School Counseling Association.
Yes, I think probably one of the more biggest highlights that really come up to mind is when when we reach out around, I have the opportunity to talk to the awesome members that we have. Is one of them is really talks about working closely with families, with students, collaborating with administrators and teachers to help students really create and deliver, create classroom lessons, but also delivering classroom lessons. We're not talking about being blocked into a schedule. We're talking as an art or a special, but really going in and creating and implementing a social emotional curriculum and being able to do that with fidelity and having the time to do that. So that is one of the things that is a highlight for our members, have talked about that. But the biggest challenge is making sure that there are other scheduling things, and whether they're required to do 504 or lunch duty or those sort of things, it sometimes causes a challenge with being able to do that and have that.
And Brand will bring you back to a success. Give me that success.
Oh, no, I'm about to say, that's what I was just about to say. That it really gets into the space of really having them have an opportunity to be able to meet the needs of students. And that is probably the biggest thing that school counselors say, is really having the time in their schedule to meet and be able to serve our families and students in Maryland.
Well, thank you so much. And I'll just reiterate that point, especially as a school counselor. And when you have a great school administration and you all work together, that's been a success that we've had at our school, is a dynamic administration who understands these things, and everyone working together. And Mr. Moore, as you continue to travel around the state, what might be some of the success that you might want to highlight from other educators or mental health providers?
Yeah, I think that at first I'm loving all these, and I think we've been able to see a lot of these, how you see them in practice and work within individual communities. I think that there's something that I think also becomes very important, and Dr. Fulgham, you touched on it earlier. It's if we aren't addressing the point of poverty, we're going to make all this stuff just remarkably more difficult. And because I'm thinking about even some of the solution sets that we're seeing here, and because we're watching how all of these things are very much they're very much intertwined. And so when people are asking about, like, well, how is poverty showing itself, and that's in urban, rural, and suburban environments, like, is it in education, is it in mental health, is it is it in transportation, is it and the answer is yes. Right? It doesn't pick and choose. I say, poverty is kind of like water, that when water floods in, water doesn't say I'm going left or I'm going right. Water goes everywhere where there's a hole, right? And this is the challenge that I think we have. And so it's like, for us to be able to find the things that are working, I think one of the things that are working that we saw, you watched how last year the adjustments to the child tax credit were made. And basic adjustments to the child tax credit, by making it fully refundable, by paying it monthly instead of annually, because I don't know anyone who gets paid annually. I mean, everyone gets paid month to month. How that one adjustment literally helped to cut the child poverty rate in this country by almost half. One simple adjustment in the stroke of a pen. I cannot overstate what kind of pressure that takes off of a family, when now they don't have to worry as much about the basics. They don't have to worry about the basics of food or medicine, or all these things that for so many people just taken for granted. But for a child who's growing up in poverty, these things are massive and can be massive derailments, particularly if you're coming up in areas and communities where the chances of a child who's born into poverty of actually dying in poverty are remarkably high. And so, so the thing that I would point towards is, the fact that there was a moment, and unfortunately it seems like this moment is fading, and we've got to bring this back, where we actually felt like we were getting serious for a little while about poverty and about child poverty, and making adjustments to the child tax credit, doing things along those lines, the earned income tax credit. That actually you started to see was making a market impact on child poverty rates, and then in turn could make a long-term impact on the additional supports that families need, are going to be required for children, and to really put them on a proper pathway to long-term success.
Thank you so much. And just like that, the time moves so fast. And I look forward to us being able to have further conversations as we move forward in this important work that must be done. And so as we're getting ready to close, I want you to pay close attention to the link that will be dropped in the chat. So we didn't get a chance to get to our Q&A, but our Q&A moderator is going to drop some links in the chat. And those of you who are viewing, those of you who are watching this on video, watching the recording, there's a Google form that's there where we'll take your feedback. You can put your questions in there and we'll get back to you. What I want to be able to do is just say thank you. We want to say thank you to all of you who are joining us today. Your presence and your participation is really an important part of this bigger push to build community tools, partnerships, and interdependence so that youth, all over this state, whether you're in the rural, suburban, or city, but all of our kids, all of our Marylanders can thrive. You see, it's our shoulders that they'll stand on. And we got to take a knee so we can let the young people climb up on these shoulders that we all share, where we put differences aside. So I want to thank you, President of the Maryland School Psychologists Association. All right, I want to thank the representative from the National School of Social Work Association. And I want to thank our president of the Maryland School Counselor Association. And finally, I want to say thank you to Mr. Wes Moore, the Democratic gubernatorial candidate, for taking time to join in this wonderful conversation on student behavioral health. And as I've heard you speak, Mr. Moore, about the importance of partnerships, I'm sure I could speak for all three organizations that we look forward to the partnerships. And more importantly than the partnerships is the impact that will come out of the partnerships as we continue to march forward. And in your own words, where we leave no Marylander behind. Thank you so much for joining us. Mr. Moore, I'll let you have the closing remark.
No, I can't follow that. No, I just want to echo that. I just want to say thank you, and I can't wait. I can't wait for the hopefully for the opportunity to work very closely with you. And when I say work closely with you, I mean exactly that. We're not gonna be able to get this work done without you. We're not gonna be able to have the kind of place and state and communities and environments that I know we can have if we're not working in hand with you. So I could not be more grateful for today, but I couldn't be more grateful for tomorrow and the day after, and what I think we can get done over this next decade. I'm really hopeful that we can really build an entire ecosystem, an entire school ecosystem, an entire community ecosystem that our children deserve, and that our future is going to require. So I'm grateful and thankful to each and every one of you for allowing me to not just partake in the conversation, but to learn from it.
Thank you so much. Dr. Ham, I will humbly return it back to you. Thank you for putting this together. And I look forward to us doing the work.
Yeah, that's it. Time to work now. So thank you. Thank you, everybody. And this has been recorded. I will stop the recording and you'll be available for each of your members, and we'll make it available on our website as well. So thank you so much. And now the work begins.
Thank you so much
All right.
for allowing us
bless
to
you all.
participate.
Yeah.
Thank you.
Absolutely.
Thank you.